Hi everyone, welcome to another lecture on valvular heart disease. I am Dr. Rahil here. In the previous videos we learned about mitral and aortic valve problems. Today we will discuss pulmonary stenosis and regurgitation in this video. Pulmonary stenosis or narrowing of the pulmonary valve obstructs the blood flow from the right ventricle into the pulmonary circulation. Etiology. Majority of cases of pulmonary stenosis are congenital and frequently associated with genetic syndromes. And coming to the clinical features, the main pathophysiological consequence of pulmonary stenosis is right ventricular strain and an increase in right ventricular pressure. Patients with mild pulmonary stenosis may be asymptomatic. Severe stenosis results in dyspnea, exercise intolerance, cyanosis, syncope, and right heart failure. Characteristic finding on auscultation is ejection systolic murmur with or without a systolic click. This is loudest over the left second intercostal space with patient leaning forward. The severity of pulmonary stenosis is related to the duration of the murmur rather than its loudness. The murmur sounds like this. Investigation. Echocardiography is the investigation of diagnosis and assess the severity of pulmonary stenosis. Treatment. Mild pulmonary stenosis is a benign condition and does not require any intervention apart from regular follow-up. In moderate to severe or critical lesions, percutaneous balloon pulmonary valvuloplasty is indicated. Surgical valvotomy is reserved for treatment failure and contraindication to valvuloplasty. This concludes the discussion of pulmonary stenosis. As always, thank you for watching, and I will see you in the next video on pulmonary regurgitation.